Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with tiger nut. I title it Fastest Natural Laxative. The medicinal role of tiger nut is not in doubt because of the various constituents which I shall try to expose in this slide session. And when we talk about laxative, we are more or less talking about changing the issue of constipation. The cause of constipation are so many, and that I shall also expose. But the constipation we are going to address is the simple constipation where there is that stasis. The stool is not coming out and there is bloating or flatulence. These are issues that I shall address in order for us to have a deeper understanding and greater understanding of it. The laboratory investigations on the laxative effect of tiger nut will also be exposed, and many other things. What we stand to gain from this is also to revolutionize our understanding of the benefit of tiger nuts as a laxative. If you like my presentation, yes, press the like button. Subscribe as we go on into the slide section. The objective: to expose the laxative effect of tiger nut Cyperus esculentus among its many properties and why it should be considered among very effective laxative. The introduction. Tiger nut is the tuber of Cyperus esculentus. Because of its great output and its several potential, they are today extensively cultivated all over the world, although they were formerly only found in the Mediterranean area. It is a slender rhizome that produces little tubers at the top of the subterranean stem. They are divided into 4 different types according to their colors: yellow, red, black, and brown. Ghana and Cameroon are home to the common red and black variety of tiger nut respectively. Yellow tiger nuts also provide more protein and less fat than the nuts when you compare it with other nuts. The advantage of tiger nuts is tremendously high. So by the time we look at the constituents, we'll be able to see what makes it very medicinal. Let us look at some definitions to understand it better. Laxatives are a type of medicine that cause changes in your digestive system that makes it very easy or easier for you to poo, and are used to treat constipation whenever drinking plenty water or vegetable fail to relieve the constipation. Constipation occurs when your bowel movement becomes less frequent and stool becomes difficult to pass. Stool now piles up. It is one of the most frequent gastrointestinal complaints in the United States. At least 2.5 million people see their healthcare provider each year due to constipation. It's not easy. Yes, let's examine why people should suffer constipation, the causes of constipation. When food moves from through the digestive tract, the small intestine gradually absorbs the nutrients in the simplest form. The partially digested food, that is the remaining ones, becomes waste that passes from there, move into the large intestine and become poo. And good enough, tiger nut is insoluble. The fiber is very much insoluble, so it is just moving along with all the other waste, and it would not allow them to really form a very compact, solid waste. The colon absorbs water from this waste, which makes it more solid. It is this unmoving solid that causes constipation. The more it stays, the more it gives the colon more time to absorb water from the waste. The stool becomes very dry hard and difficult to push out. But when you have taken tiger nut, you find it that the thing becomes bulky and soft, very easy to pass out. That is the experience, even my own personal experience. Lifestyle factors that will cause constipation include common lifestyle causes of constipation include not eating enough fiber, not drinking enough water, consuming large amount of milk or cheese, stress, medication, pain drugs, NCAI, that is non-steroidal anti-inflammatory drugs and antidepressant drugs. All these add up to what could cause this simple constipation, that is the stool not moving, staying put. Let us now look at the constituent of tiger nut to really look at my reason of encouraging people to take tiger nuts as a laxative. The constituents, according to several studies, tiger nuts are very nutrient dense. These are the many advantages, all the content. But the area that concerns us the most after going through all these contents of this 1 ounce of raw tiger nut contains 120 calories. Rich, the calories rich. So you don't have to eat too much of it. It becomes high calorie food. But it has very low protein, and you want to now be afraid of being prone to diabetic. But the most destructive aspect is the fiber. The fiber is 10 grams. You can see the highest gram, apart from the carbohydrate, is 10 grams of fiber. So that fiber that is so much in it is what really would help in that digestion. It will help to stop constipation so that one can easily pass the stool. It would soften one's stool and very easy to pass through the rectum, and obviously the pains associated with constipation, where you start having stomach pains and bloating, flatulence, and what have you, will not be there. Let's look at what really makes tiger nuts a good laxative. There are 4 main types of laxative because of the way they work. The first one is bulk-forming laxative. It works by increasing the bulk of weight of the poo, which in turn stimulates your bowel. And that was the finding of some great workers. And tiger nut is bulk-forming because it's insoluble. It's an insoluble fiber. Because it's very insoluble, it will now make the waste bulky because of its insolubility and soft, so that it is there is even moisture in it, and it will not allow the waste to be really compacted. It retains its own integrity, and that way, because there's the waste is soft, the poo is soft, it will easily come out. The other ones are osmotic laxative, that draws water, just like when you use MC salts. The example of osmotic laxative are listed there. Then there is the stimulant laxative. This stimulates the muscles that line your gut, so it makes the movement towards the rectum. And then the poo softening, that's more like water. When you take water, at times it doesn't work. So it's more like water. This type of laxative works by letting water into poo to soften it and make it easier to pass. Now, let's examine key WHO, World Health Organization, key facts about constipation itself. As far as WHO is concerned, constipation is more of both organic constipation as well as functional constipation. You divide it into the organic constipation is usually associated with mechanical obstruction, such as narrowing of the intestinal lumen due to tumor like cancer, scares, adhesion, and also abnormalities in the intestine. So you have things like megacolon, megasigmoid, diverticulosis, and these are problems that really seriously cause constipation. But the other one is the simpler one, functional constipation, where you have the normal anatomy of the this thing, but like the one we are talking about, uh, colonostasis, where is the simple constipation that we're really talking of fibers really moving it or water. Then there is the neurogenic constipation. There is also constipation associated with inflammatory diseases, toxic constipation, constipation of endocrine etiology caused by the hypofunction of the thyroid or pituitary gland, constipation caused by lack of physical exercise, metabolic constipation such as in hypokalemia, where you have low potassium, psychogenic constipation, and muscular constipation. All these are the different type of constipation. So it's not something that is so easy. But like I said, what we are more or less talking about is simple constipation that you need laxative to really move it. So you need a deeper understanding of what constipation is all about. Now to laboratory investigation. Laboratory investigations usually is a laboratory diagnosis, and that is when you want to know the type of constipation that were listed there. But that is not the concern of this study. We are talking of tiger nut as a laxative, a very effective laxative. So all that we want to prove is just research to prove that yes, tiger nuts or fibers could have serious effect on constipation. So curing that problem of constipation. And so the aim is to investigate the effect of dietary fiber intake on constipation by a meta-analysis of randomized control trials. That is, so many trials that has been done. Pulling the articles were eligible, so many articles were eligible for the meta-analysis if they were high quality RCTs and reported data on stool frequency. The stool frequency is very important. Stool consistency is another treatment success. You are now comparing with laxative use and the gastrointestinal symptoms shown. The result from this study shows that dietary fiber shows significant advantage over the control placebo in stool frequency using all these statistical analysis. Conclusion: dietary fiber intake can obviously increase stool frequency in patients with constipation. So that is, in a nutshell, is talking about dietary fiber, of which tiger nuts has a large quantum of dietary fiber. But majority of time, people just want to throw away the fiber itself, whereas it is that fiber that should help in that digestion, allowing the food to be well digested and also saving the person from colon cancer. These are some of the references. You can look at it. Effect of dietary fiber on constipation, a meta-analysis, and also the dietary fiber in this tuber is effective in the prevention of colon cancer, obesity, and gastrointestinal disorder. So, role of fiber in cardiovascular diseases are all studies that could help for better understanding of the medicinal properties of tiger nuts. Another investigation of interest is the effect of tiger nut on the hematological and biochemical profile of male cholesteremic subject in Uli town of Anambra State. So the evaluation was done, and it was found to really have medicinal property to lower the cholesterol. Another research topic: the effect of fiber supplementation on chronic constipation in adults, an updated systemic review and meta-analysis of RCTs. These also found the conclusion that Fislium is the most efficacious investigated fiber at providing constipation relief So all these are geared towards understanding that the fiber, dietary fiber, is very, very good. Finally, the conclusion. The knowledge of phages and dietary fiber as aids of digestion is very elementary and old, and any study to prove otherwise must be statistically significant to even be acceptable. I'm sure even it will be contested because it has become more of a law than even a theory or considering it an hypothesis. Very few researches on the laxative effect of tiger nut had been done. But with this exposition of its laxative effect, when eating whole nut or tuber with rice, a large population test will surely add more to knowledge. If you find this interesting, you can check more of health issues, things that will improve our health, and also just like if you find it interesting, and also subscribe.